Text, UCLA Undergraduate Education Disability Studies. Lauren Clark.
I'm Lauren Clark. I'm a nurse. I'm a professor of nursing at the UCLA School of Nursing, and I'm the Shapiro Family Endowed Chair in Developmental Disability Studies. We started our research looking at quality of life, and as a nurse, I'm really concerned that there are medical interventions or social welfare interventions that may change the life course of people with disabilities, and we don't really know if we're making it better or worse. So the most important part for me was finding out what the quality of life outcome would be for different interventions. And so we needed a measure for health-related quality of life for people with intellectual and developmental disabilities. And that measure could be used anytime we change something. And so we developed this new measure. And to do that, we interviewed people with intellectual and developmental disabilities and asked them what were the indicators of quality of life. There's a whole lot of research and theoretical framework to that, and we built on other people's research. That was my first research study. The next one had to do with parents of children with intellectual and developmental disabilities, because finding out that your child has a disability is the moment when you find out your child is often far from the tree. And what do we do when we have a child with an identity that's different from our own? And we found out by interviewing over 40 parents and a number of grandparents that it was a time of grief and mourning. And that comes probably from our ableist perspective that a disabled life is not a life worth living. So we talked to parents 2 years and 3 years out about how they made a meaningful life going forward. And we used that and packaged that as help for other parents to try and shorten that journey of grief and hasten the journey towards acceptance and a full, thriving life with their child. And the study we're working on now has to do with preventive care, and it has to do with the health disparity around vaccination. So we looked at a big data set of 30 million lives, and inside that big insurance data set, there were a number of children with autism, spina bifida, cerebral palsy, and intellectual disability. We looked to see if they had equitable administration of HPV vaccination, and we found out that children with cerebral palsy are 7 times less likely to get vaccinated, children with intellectual disability 3 times less likely, and the other children twice as unlikely to get vaccinated. We've now taken that quantitative data and we've built a qualitative study to talk to parents about what goes into decision-making around vaccination for a child with a disability. Disability studies came about as a discipline long after I finished my nursing education. It's impacted my work because I've learned that there's a medical way of viewing deficit-based health conditions. There's a social model where we consider the environment, we consider people's reactions that disable individuals. And then, most important to me, is a social relational model where we think about suffering and enduring. We think about people's choices about what they want to do and how we as nurses can support it. So disability studies has given me new theoretical frameworks to think about disability and what nurses can do. So it's a very important and necessary part of health science education.
www.disabilitystudies.ucla.edu